Hi, I'm David, co-founder of JaGa app and JaGa. Today I want to talk to you about JaGa, our latest booking platform for services that come to you. We never knew that we can do a lot of things at home. We've done Zoom yoga, cooking lessons, tuition classes, and many home services at home. That's why we built HeyJaga.com and put it all together for your convenience. Sure. Thank you. Come, let me show you how it works. Follow me. So, I'm going to give my wife a surprise by getting her a part-time maid. It's good for her to have a rest day once in a while. All I need to do is open up my browser, go to HeyJaga.com, and here you can see there's a search bar to look for services that you need. There's some simple instruction on how to use the website, and if you need some inspiration, you can also check out Raji Boy's recommended list here as well. And yes, you can create your own list by putting all your vendors together and share with your friends and family with ease. Good things must share, right? Okay, back to business. I'm just going to search for a home cleaner. And after checking out their terms and description, this one seems pretty good to me. I will select my preferred date and time, click book, log in, and voila, all done. That's simple. Hey, that's the email from the cleaner saying that all has been confirmed. All good to go. That's easy. For those of you like me, who is always on the go, fret not. You can also access HeyJaga.com through our latest JaGa app 2.0. In JaGa app 2.0, we have a lot of interesting features that will cover more of that in our future videos. See you there.
Hello， 你好，我是 CD Plus FM 健康一把抓的主持人 William 景佳。今天我来到了双威中医中心，这是一家结合了中医和西医优势的专业医疗中心，所以来到这里的病人都能够获得更全面专业的医疗服务。双威中医中心的医疗专科可分为肿瘤科、妇科以及骨伤科。话不多说，马上跟随我到双威中医中心去走一趟，亲身体验这里贴心专业的医疗服务吧。说到中医医疗，我们一般所知道的就包括了针灸、拔罐，而今天我们就特别来到这里体验针法医疗的服务。针法的使用范围就包括了可以缓解关节部位的问题、偏头痛、骨盆疼痛等等。 医师使用一次性无菌针灸针，在特定的部位按照一定的角度刺入患者的体内，通过刺激穴位来达到治疗疾病的目的。那我自己试过这个针灸过后，我感觉是比较还蛮好的啦，感觉并没有想象中人家会觉得那个针刺下去然后会痛还是什么，可能就像刚刚文医师你说到的一个方式，可能吸气呼气，它有帮助舒缓这个肌肉，所以并没有那个所谓痛，但是稍微会有点麻的感觉。
这是正常的。我们说针灸的时候会有一种得气感，那得气感就是会有酸胀麻，有的人会觉得痒痒的，也是因为当我们留针的时候，我们也会做一些行针的手法，做提插、捻转这样的一个转动那个针的一个手法，让调动气血。
所以文医师一般上像我们现代人可能面对最大的问题是压力很大，然后可能睡眠不好、精神不足，那你们怎么样去做一些平常的养生或者是保健等等这些做法？
一般来说，我们可以有2种方式。简单的说，就是在那个午休时间，你可以选择在饭前或者是饭后进行一个午睡，10分钟到20分钟就好了，不要超过20分钟。因为尤其是11点到1点之间，可能1点左右还没有吃饭之前去午睡一下，就是它可以抵抗那个消除压力。然后保护心脏，因为那段时间正好是11点到1点，正好是心脏的那个经络，就是适合养生养那个心脏经络的一个时间段。
过后，那我知道你在采用一些手法嘛，那这些手法它究竟有一些什么样的特点呢？我们看到也是很多在做推拿、做一些按摩之类的。
对啊，通常大众呢可能看到对于那种软组织损伤的治法呢，他们都是属于稍微用力的，甚至于有些人会出一些什么越痛越好之类的东西，但是我十分不赞同这一类的说法的，因为其实呢，真正调整的话，你需要把它真正的肌肉放松出来，而不是单纯的挤压方式去处理就可以好的了。然后过后呢，我的手法呢是相对比较柔软，然后是顺应着人体的关节活动范围去做调整的。
我们知道中医在治疗与诊断过程中呢，存在一些盲点。我们通过问诊、舌诊、脉诊来了解我们病人，但是在面对重大疾病的时候，比如说肿瘤，我们没有办法很好的了解到这个肿瘤在哪个位置，所以我们需要靠现代医学的一些诊断手法，比如说 X-ray 啊、MRI 啊、PET scan 之类的，来对我们患者有更进一步的了解。只有在我们对患者有更完全或者全面的了解情况下，我们才可以做出一些针对性的治疗，也可以更好达到根治性的一个方案，这也是我们患者最希望得到的。
好的，谢谢。这一次来到双威中医中心，体验到了真正让人感觉到安心和专业的医疗服务。从我一踏进门口到刚刚拿到药为止，我看到了这里每一位医护人员的细心、贴心和专业。双威中医中心结合了中医和西医的优点和长处，致力于为病人提供一个更完善和更有效的医疗解决方案。这正是我们最需要的人性化优质医疗服务。双威中医中心全方位守护你的健康。
Welcome to the University of Sunderland School of Medicine. It gives me great pleasure to introduce our 5-year MB-CHB with Honours programme. We will be taking our first cohort of 50 students in September 2019. Year 1 and 2 of the course are very heavily focused on the supporting medical sciences such as anatomy, physiology and biochemistry. However, what we do is we structure around problem-based learning and build upon problem-based learning throughout the 5 years in a spiral curriculum. Year 3 and 4 are the start of the clinical placements, and you'll spend most of your time in our partner acute trusts as well as the mental health trusts in the northeast of England and many of our GP practices. In our 3rd and 4th years, You will have the opportunity to spend an additional 4 weeks in each year studying any specialty that you like in many of our hospitals around the region. We've invested over £15 million in the Sciences Complex, so what we can do is offer clinical simulation. We can demystify some of that clinical environment before you go out into the real world setting. Interprofessional learning at the University of Sunderland School of Medicine is a significant focus for us, and that's because we recognise that the National Health Service requires that team-based working. So you will be learning with pharmacists, nurses and paramedics. Year 5 is our clinical assistantship year, where you will spend time shadowing doctors in hospitals and general practice, learning how to become a practicing doctor in readiness for qualification. Also at the end of year 5 is an opportunity to do your student elective, and this is a time where you can choose any specialty to study anywhere around the world, including our campus in Hong Kong. Following graduation from the University of Sunderland Medical School, you can follow any career that you wish. There are more than 30 specialties that you could follow. It's highly likely that through role modelling and championing you may become general practitioners, and you will go into foundation training year 1 and year 2, and then from that you will move on to specialty training. Take a look at our admissions criteria on the website. Our intention is to make medicine more accessible to less advantaged students. So why not come to our open days and have a look at our 3 wards, our clinical simulation suites and our industry specification laboratories, and make that judgment for yourself.
All right. Good afternoon, everyone. My name is Gwen. I'll be the moderator for today's webinar. So welcome to the Bye Bye Pressure Ulcer Hello HOFA webinar. This webinar is organized by Caregiver Asia Malaysia, co-organized by Braun and JaGa, sponsored by Sunway TCM and Education Network Consultants ENC. So we welcome everyone and thank you everyone for joining us today. Please be noted that this webinar will be recorded and it will take about 1 hour, including the Q&A sessions. So after the Q&A, we will take a group photo together. So let's say if you need to make up or you need to dress up, please do so, right? After the taking photo together, we will do a lucky draw. The lucky draw will come after that, and please make sure you stay until the end, all right? And also we will give you a sign up frisbee. So sign up frisbee plus a certification of participation if you stay on with us. So before we start, I would like to remind everyone to please mute your speaker. So if you have any question in the middle of the webinar, you can post it in the chat. Yeah, like someone is posting there now. You can post it in the chat and I will read them out at the Q&A session later, all right? So now, without further ado, let us get into the first topic, skincare pressure injury prevention. Our first speaker, Mr. Kelvin Leong. Kelvin is the nurse manager at Caregiver Asia Malaysia. He holds a master's degree in medical education from University of Dundee, United Kingdom. He has 15 years of clinical and lecturing experience focusing on traumatology, medical sciences, and mentoring in healthcare. Kelvin is also the trainer certified by HRDF Malaysia. He is a life member of Malaysian Associations for the Study of Pain, MASP, and Malaysian Society of Wound Care Professionals, MSWCP. Currently, Kelvin is pursuing his postgraduate studies in clinical wound care. We welcome Kelvin. Please, Kelvin.
Thank you, Gwen.
Thank you.
Okay, so let me just share my slides. Okay, good evening, everyone, and welcome to this webinar. So today we will be looking at pressure ulcers. So my part will be talking on skincare and pressure injury and how to prevent pressure ulcer. So I understand that there are nurses, there are doctors around here as well as the general public. So we will not be using a lot of very technical terms, but we cannot sway away from showing a few pictures that are quite gory because it's on ulcers. So this is a forewarning, but there won't be a lot of that. So it'll just be a couple of that. So today, to start, we'll be looking first and foremost at what we'll be covering. This is for my part. We'll be looking at the skin, a little bit about the anatomy of the skin. No exams, don't worry about that. Then we'll look at the aging skin and what are the common problems that elderly have and how you can help to prevent them. Then we'll be focusing a little bit on pressure ulcers, its prevention and management. A few things on good skincare and what we are supposed to report if we find any pressure ulcers developing. Okay, so let's look at the first part, that is our skin. So we need to know that the skin is the largest organ of the body in terms of surface area and weight as well. There are 3 layers to the skin. If you look at the picture, you can see that there is the epidermis layer, the dermis, and the hypodermis. So the epidermis is the uppermost layer here. Okay, so this area does not have any blood vessels, but it provides a waterproof barrier and it creates our skin tone for us. So it contains skin cells, the pigments, so whether you are fair skin or darker color skin, so it all depends on the epidermis. The middle layer, which is the dermis is over here. So over this layer, you'll see that it contains a lot of blood vessels, nerve, hair follicles, as well as glands. So over here is if you prick yourself deep enough, you start to bleed because the prick will have entered into this area. Yeah, and this is where you can feel pain because of the nerve endings around here. And the third layer will be the one down here. This is the fat layer called the subcutaneous layer or the fatty layer. So over here, you will find the sweat glands as well as the fat, and some of the hair follicles are also from here. Now, it is important to know the layers because later when we go into the stages of pressure injury, it will depend on which layer that the pressure injury has affected. Yeah, and then the treatment will be different as well. But this talk, we will not be focusing so much on the treatment. We'll be looking more on how to prevent pressure ulcer from happening. Right, so the skin has a few functions. So the first function is that the skin is a protective organ. So it is a barrier against infection germs, as well as mechanical impacts, mechanical pressure from radiation, as well as chemicals. That is the first function of the skin. Our skin also helps us to regulate body temperature by either sweat or by erection of the hair follicles whenever we feel cold. Now, one of the most important things for us to know, and most of you will know this, is that the skin helps us to produce vitamin D. So vitamin D has been shown not only to help with your bones, with the absorption of calcium. However, it has also now been shown that if we do not have enough of vitamin D, it can lead to depression. So it is important for those of us who don't see a lot of sunlight, especially if we work indoors all the time or we work a lot of night shifts. It is important to get a bit of sunlight every now and then so that your vitamin D is balanced. And our skin is also an organ for sensation, whereby we can feel pain, we can feel heat, we will know what's going on in the environment, environmental changes in terms of temperature. Okay, as we age, what happens to our skin? Our skin will become thinner, more fragile, and very commonly skin tears can happen, especially in very old people. So we will also see large pigmented spots will appear, especially around here. You will see these are actually sun damage from much younger. So when we age, what happens is that this sun damage will surface onto the skin and we can see a lot of freckles, sunspots, and so on. The skin will also lose strength and elasticity. This is due to the loss of a connective tissue in the skin. Next, we will see that blood vessels will become very fragile. So over here, you can see that a lot of bruising can happen to old people. If they knock themselves a little bit, you can see that they bruise very easily. All right, and then you will see that there's less sebum production. Sebum is oil production, especially for women after menopause. Therefore, the skin can become drier, and this will tend to lead to itching of the skin as well. The fatty layer, the third layer, will become thinner, and therefore it is less insulation and less padding. So it does not protect the body very well from cold. That's why older people tend to feel cold easier. We will also find that sweat glands can produce less sweat. Therefore, it is much harder for older people to regulate their body temperature. And you will find that skin growths are more common in older people. You'll find skin tags, rough patches. Yeah, most of them are not cancerous. However, some we need to be a little bit more careful. So these are more common skin problems that you'll find. The first one is dry skin. You'll find older people, you can get dry skin, and not only older people, some people, if they work under aircon conditions, yeah, you'll find that dry skin is very common. So this is due to the reduction of body oil, either by dehydration or even malnutrition. So how can we help as caregivers? We'll need to make sure that we apply moisturizer at least twice a day. The soap that we use has to be a non-soap based body wash. There are a lot available in the market that you can find that has soap free. And humidifiers can help to rehydrate skin, especially if the person stays under air-conditioned room all the time. And avoid showering with hot water because hot water can dehydrate the skin. Warm water or cold water is recommended. We do encourage fluid intake unless it is contraindicated. If the patient has kidney problems, therefore we need to be careful on that aspect. Yeah, and of course, we have to encourage good oral intake of nutrition. So this is a second very common skin problem, cracked skin. Normally we'll find this at the heel or at the palm of the hand. So the reason why this happened is similar to the first one, is due to dry skin. Yeah, and for these, mostly it's friction from improper footwear, especially people who like to wear sandals. You can expose that part to a lot of friction. So what we do is we will also need to moisturize the skin. Yeah, make sure that we use a non-soap based cleanser. And proper footwear is important. Yeah, shoes that are not too tight or not too loose, and encourage intake and then proper nutrition as well. Right, this is, we're starting to get to the more gory pictures now. So this is a rash, a nappy rash. Yeah, this can happen due to prolonged contact with urine or fecal matter, especially in those who wear diapers. This is, of course, the buttock area. This will be the tailbone. So here you can see this can be caused by poor hygiene as well, especially people who are wearing pampers and then diapers and then don't change it regularly, or when the diaper is too tight. Yeah, this can trap in the moisture and the heat, and it can increase this kind of rash from happening. All right. So what happens is that we need to clean or change the diaper regularly so that we make sure that the time contact between the skin and the excrement is not a lot. Then we will protect the skin using moisture barrier cream or moisturizers. Yeah, a few which we will show you in a little bit. And avoid excessive force or friction during transfer. So when we transfer the patient, we don't pull the patient, we need to lift the patient. So there are a few methods of doing that as well, which I will share with you in a little bit. Okay, and we need to avoid prolonged sitting on bedpans or on commode chairs if these patients use them. Okay, another kind of common skin condition that we can find will be fungal infection. The picture you're seeing here is a fungal infection called ringworm infection. Ringworm on skin is not caused by worms, it's caused by fungus. So where we find all these fungal infections are normally in places whereby it's wet, yeah, in skin folds, normally at the perineal area, the groin area, or even the inner thigh area. Sometimes you can find them in toenails as well. All right, so fungal infection are normally present in people with low immunity and poor hygiene, or whereby the diaper or the pants is too tight. Therefore, they trap the moisture and the heat. You need to remember that fungus grow very well in moist condition. In wet condition, they can really, really thrive. So for fungal infection, unfortunately, there is no other way to treat it but to use medication. So you can consult a doctor for treatment. They will give you an antifungal cream. Right, so you need to follow the treatment strictly because it's not a one-day treatment. It can be up to 2 weeks sometimes. And good personal hygiene is important. And of course, we need to strengthen the immune system of the patient, yeah, and by proper nutrition as well. So like I mentioned earlier, in older people, the blood vessels are rather fragile. So this will be another very common condition you can find in older people. This is called a hematoma. It's just a fancy name for bruise. So this is quite common in elderlies. So what causes this are the weakened blood vessels, and then if they hit on something, or they fall down, you can find this bruise under the skin. Right? So even rough handling of elderly can cause this. You know, when we want to transfer an elderly patient from the bed to the chair or from a bed to another bed, if we are rough, this can occur. Yeah, and malnutrition also can cause this, as well as certain medications, especially if the elderly is on blood thinners, like aspirin. So it's very common to find this in patients who are taking anticoagulants, blood thinning medications. So what we can do is we can remove clusters, remove the hazards of fall, so that we make sure the patient is quite free from all these hazardous materials. So if the patient does fall down, what we can do is immediately we can use a cold compress for 20 to 30 minutes. So this is to stop any bleeding around here, hopefully, and this won't cause the bruise. Right? And for those who are on those who are on blood thinning medication, we will need to apply the pressure for a bit longer to make sure that the blood stops and it doesn't cause a bruise like this. Okay, the next one will be pruritus. Pruritus is itching of the skin, right? This is itching of the skin. So this can be because of many other underlying problems like kidney problems or liver problems. People with anemia, thyroid, even diabetes, or even certain drug allergies can cause this. In aging people, skin itch is quite common because of dry skin. And we need to first find out what is the cause of the itch, what's causing the itch, and then we will have to consult doctor for the appropriate treatment. So what we can do at home is we can protect the skin using moisturizers, and it's similar, we bathe with mild soaps or no soap preparation. Okay, use warm bath, but not hot, and avoid scratching, because the more you scratch, the worse the itch becomes. We can also switch to cotton clothing instead of wool or synthetic material. That can help with the itch. So over here, these are pressure injuries or pressure ulcers. So what causes them is long-term pressure on certain parts of the area, particularly bony areas. So that will cause the circulation, blood circulation, to be slow or even stopped. And incontinence can cause that as well, whereby the area is wet, malnutrition causing the skin to break down, or even dehydration. So for pressure ulcers is rather tedious to manage, because we need to turn the patient every 2 hours to avoid pressure from injuring the skin. Applying moisturizer agents like twice a day does help, and we will use barrier creams on areas that are wet, particularly the groin or even the perineal area, the buttocks. Yeah, use pressure relieving measures like certain mattresses and all, which I'll show you in a bit, as well as we need to encourage fluids and oral intake if it's not contraindicated. So if the wound becomes really bad, then normally the patient will need to consult a wound care professional to manage the wound. Now we will dive into what pressure ulcer is. So pressure ulcer causes the skin to break down. There are typically 4 stages of pressure ulcer over here, which I will explain in a little bit more detail. However, what we will do now is we will look at the places that you can get pressure ulcers. So these are the common areas where you can get pressure ulcers. So pressure ulcer is caused by friction or shearing forces to bony prominence. So you'll see all these areas are where the bones can be, right? It's very prominent, the bones. So therefore, these areas you can get pressure ulcers. So any moisture or friction can also cause the superficial layer to break down. So common areas will be the shoulders, shoulder blade area, all right, elbow area here. Okay, the back of the head, this is what we call the occipital area. This is actually more common in young babies as well, if they don't switch the position. All right, and the rim of the ears as well, the hips, the knees, Now, this position, not many people sleep in this position. However, because of COVID, if you have heard before, people who are nursed in ICU for COVID are sleeping in this position. Therefore, these will be pressure areas that we will need to look out for. Okay, so for people or for patients who sit out on wheelchairs, sometimes you find that in some nursing homes, they will get the patient up on a wheelchair and the patient will be sitting there for a very long time. So the areas that can get pressure injury are normally the shoulder blade areas, the buttock area, all right, this is what we call the sacral area, the heel, as well as the ball of the foot. Okay, normally for wheelchair over this area here is not padded. This is just metal, so it is actually very, very damaging for the skin. So these are the factors that contribute to pressure injury. First will be the impaired sensory perception. So in older people or people with diabetes, sensory perception is impaired. Then the physical condition is impaired, particularly in people with stroke. Then you'll find that people with peripheral circulation impairment. So this is also for people who are obese or people who have diabetes, right? And incontinence of stool and urine can cause that too. And we find that because of the trapped moisture from the incontinence, that can lead to pressure ulcer. Poor nutrition and poor hydration is a common problem that can arise as well. And for people who have orthopedic injuries, bone injuries, some of them, they are on cast or on orthopedic traction. So those things can also cause pressure injury, right? And for people who have chronic diseases like diabetes or stroke that can impair their healing ability, therefore the pressure ulcer do not heal that fast. Now we will look at the different stages of pressure injury. So there will be some pictures over here that you might want to be a bit cautious. But anyway, let's have a look. So this is stage 1 pressure injury. What you're seeing here is the heel of the patient. So for stage 1 pressure injury, we can still do a lot to prevent it from going into deeper stages. Okay, one of the things will be to apply a moisturizing agent and to make sure that this area is lifted so that there's no pressure forming. Now, how do we know that it's a stage 1 pressure injury? It's very simple. What you will do is you will press this area. Normally, if you just press your skin, you'll find that your skin will blanch. It will turn white. But when you lift your finger, what happens is that it will turn back into its natural color. All right? But for stage 1 pressure injury, if you press this area here, it will not blanch into white color. It will remain this kind of reddish color. So you know that it's stage 1 pressure injury. For stage 2, you will see that the skin has already broken. Right here, you will find that the skin has broken, and you can actually start to see the dermis, the second layer of the skin here. This is stage 2 pressure injury. This is at the buttock of the patient. Right here, I'm showing you stage 3. So stage 3, you can see that the entire dermis is very visible. Here, what you see here, the whitish area, this is due to moisture. Right, probably this patient's pampers has been soaked and then no one has changed the diapers. So you can get this. This is due to moisture injury, but this is a stage 3 ulcer. For stage 4 ulcer, this is very gory. This is the heel of the patient. This is the heel of the patient, the ankle area. So for stage 4, what you can see is that the entire dermis is gone. You can start to see muscles down here, and this is the tendon. Right? So once you see tendon, you see bone, you see muscles, that is a stage 4 injury. And there are other types of pressure injury that is not stageable. So over here, you will see pressure injury of the foot that is not stageable. Why it is not stageable is because this area, the black area here, this is what we call an eschar. So this area is covering what is inside. So we do not know how deep the injury is. So in order to stage this, we first need to surgically remove the black parts here. Then we can start to stage. Right? And the other type of pressure injury will be what we call the deep tissue injury. Over here is the buttocks, and you can see that the maroon color over here. So what this means is that deep down inside, the tissues deep down has already been injured, However, the skin is not broken yet. Yeah, the skin is not broken yet. This doesn't mean that this is anything less than a stage 1 pressure injury. In fact, it is more dangerous than a stage 1 pressure injury because inside is already damaged. Okay? Now, what is your role as a caregiver? So you basically need to maintain good skin condition of your patient by regularly inspecting the skin, making sure that there's a good hygiene and perineal care, right, to keep the skin moisturized and to avoid any soap-based cleansing agents, and do not rub or massage the skin vigorously. If you have to do anything to the skin in terms of rubbing and massaging, it has to be very, very light massage. Yeah? And you need to turn the patients who are bed-bound regularly. We recommend 2-hourly turning, and to position if the patient is chair-bound. If the patient is sitting on a wheelchair, you need to reposition the patient quite regularly. So to use pressure relieving mattresses for long-lying patients. Okay, and of course, nutrition has to be maintained. Some patients, especially diabetic patients, it is very important to consult a nutritionist as to what kind of diet that the patient needs to take, right? And to maintain hydration unless contraindicated. So as a caregiver, you will also need to report any abnormalities of the skin condition immediately to the wound care people so that they can give immediate attention. And of course, diligent wound care is important with the proper products. Right? You need to use appropriate products to make sure that the pressure injury doesn't become worse. All right, so other things you can do in terms of assisting is to ensure that the patient has good personal hygiene. So helping with showering or bathing or assisting in toilet and diaper change is important. Keep the elderly skin moisturized and well protected. So there are moisturizers in the market and barrier creams in the market that you can use, and later on Carmen will introduce some of it to you. So in terms of barrier cream, what these cream do is that they will protect the skin from moisture, and we normally put it in areas that are very wet, for example, the perineal area. The most common one used is a zinc oxide base. So zinc oxide can help to prevent and treat diaper rash as well that is caused by incontinence. However, the cream is very thick and it can be a little bit messy to use, right? And you need to massage it properly into the skin until it is completely absorbed for zinc oxide to be effective. However, these days we have more advanced creams available, like the one here. This is a skinner from Braun. So this skin actually provides a waterproof. It waterproofs the skin, okay, against urine and feces, so against very harsh chemicals as well. And if some people don't like to use a cream, there's also the spray available. So what this spray does is that it will form a protective silicone film on the skin to protect against moisture, right? And we also have some pressure relieving items for long-term patients. Normally we can use pillows, soft pillows to help. Okay, some people will buy, this is what we call a striker mattress, yeah. And for people with diabetic foot, we also have some devices that can offload the heel and the foot. So in terms of turning positions, these are the 3 positions that we can turn a bed-bound patient. Okay, whether they're lying on their back, this is called supine position. Note that there are protective pillows all over. So this is when they turn to their right. This is the right lateral, and this is the left lateral. So it is important to put pillows, soft pillows, to protect the areas that are very, very bony, right? The areas that we discussed just now that is very prone to pressure injury. So it is important that we turn the patient every 2 hours. So this is something that a lot of hospitals will use, a lot of nursing homes will use this as well. And if you have anyone at home that requires turning, you can even draw this out yourself. It's very simple. So this is a turning clock. This will be 12 o'clock, 2 o'clock, 4 o'clock, 6, 8, and 10 o'clock. So from here at 12 o'clock, you turn your patient to the, lie the patient on the back. From 2 to 4 to the right, to the left, and so on. So this is a very easy reminder for anyone. So let's say if you go to a patient and you see that oh, it's 12 o'clock and the patient is still on the left, so you might want to turn the patient to lie on the back. Right, so where to place the pillows, like I mentioned, on the head is important, at the back, so the back pillow will cover the shoulder area, right, as well as a bit of the sacral area. And the one here is very important, the pillow over here that will protect the knee as well as the, the ankles and all. Now you need to make sure that the heel is elevated above the bed. The heel that is on top, this has to be elevated above the head because this is a very, very prominent area for pressure ulcer to develop. Okay, now if you need to shift the patient from one bed to another, you need to use a draw sheet or any other more advanced form of shifting tool. Okay, so what we see here is that this thing is a shifting tool. This is made from parachute material. So you can see that these two people, they will use the draw sheet. One will push and the other one will just pull, and the patient can roll from this bed to this bed, shifted very nicely without any damage to the skin. Never drag the patient by the clothes. Okay, this can cause friction and it can cause the skin to tear. Right, there are a lot of this kind of moving equipments, shifting tools that is available in the market that can help to shift a patient without damaging the skin. For a patient who is on the wheelchair for a long period of time, you need to make sure that you help the patient to lean, right, from one side to another side for about 2 minutes to relieve the pressure on the buttock, right, even to lean forward. And of course, it's best to avoid sitting down on the same chair for a long period of time. Yeah, you can help the patient to get up and move to another chair. This will help to relieve pressure as well as to improve blood circulation. Hospital beds are very important, especially for bed-bound patients or patients who are comatose or paralyzed. So there are many hospital beds available in Malaysia for purchase. However, whenever you lift the patient, tilt the patient up or prop the patient up, you have to ensure that it is not elevated for more than 30 degrees for a longer period of time. This is because if you elevate anything more than 30 degrees, it will cause friction and shearing forces, and that can break the skin and cause pressure injury to occur. Now, the mattresses that are available to help to relieve pressure. So these are two very common ones that we find. One is foam mattress, and the other one is the alternating pressure mattress. So this is what is commonly known as a ripple mattress. So when to use which? For the foam mattress, normally we can use it to prevent. Yeah, when we first get a person who is bedbound and we check the skin and we realize, hey, you know, there is no pressure injury, we can start with this. Right? However, for patients who already have pressure injury, there's no choice but to use this. Now, please do not be mistaken. Even if we use a mattress to help to prevent pressure ulcer, we still need to turn the patient frequently, every 2 hours. Now, if we find that there is any abnormality in the skin, we do need to report this. So we will report to either the family members who are the direct caregivers so that they can be aware and they can take precautions, right? Or we can report directly to the medical team that's taking care of the patient. So this is important because it will allow us to give immediate medical attention to the person. It will also be a form of data collection for us so that we will know whether the treatment that we are giving is appropriate or if there is anything that's needed to be done extra or anything that's wrong that we are doing, right? And this will also allow us to share information from one caregiver to another caregiver so that we are very observant and then there is a continuity in terms of care for the patient, all right? So the observations will include things like, is the skin dry? Is there any skin tear or breakage? Is there any rash or discoloration or any infection has occurred? Or has the existing wound become more worse or is it improving? All right, so these feedbacks will also include whether the patient is feeling generally unwell or is the patient in pain. So we don't just look at the wound itself, we need to look at the whole patient. And are there any recent changes in terms of the patient's elimination pattern? Is the patient urinating frequently or passing motion as normal? Or is there any change in the appetite of the patient? So this is also important to note. Okay, so this is the end of my lecture. You need to just remember that any pressure injury is 80 to 95% avoidable, right? It's actually quite avoidable. Why not 100%? Because there are other factors in play, like if the patient has diabetes or any chronic illness, that can be a factor that is unavoidable. However, it is about 80 to 95% avoidable. And the next speaker will tell you a little bit about how to avoid that. So that's all from me. Thank you very much. Gwen,
thank you, Kelvin. That was very informative, especially for people laymen like me. But there are so many caregivers here, so I think it's very, very useful for them, helpful for them. All right, thank you, Kelvin. So I saw some Q&A already in the chat. Just to let you know, we will do the Q&A later after the second speakers. So we will do second speakers and then Q&A. After Q&A, we're photo taking and lucky draw, all right? So let's stay until the end. Let's go to the second topic. So the second topic will be introduction. Yes, introduction to HOFA. Hello, HOFA. And our second speakers will be Carmen Uy. Carmen is a product manager with Braun for wound and infectious prevention in Malaysia. So welcome, Carmen. Carmen, you may start.
Hello, everyone. I hope that everyone can see my slide right now. Okay, so thank you, Kelvin, for the very informative slide and presentations on the pressure injury. So hello, everyone. Today, I would like to introduce you to HOFA. How many of us actually here heard about HOFA before? Maybe just a quick, what we say is that hello or a chat, in the chat, you say yes or no. Okay, so what is HOFA actually? So we will look into HOFA. If you haven't heard about it before, this is about HOFA. I'm so sorry. I think my slide a little bit lagging here. Okay, so some introductions about or just a repeat from what Kelvin shared earlier is that pressure injury actually it is something that it raises a lot of concerns among patients and caregivers as well. And this is because pressure injury over the years, we've seen that it is a cause of morbidity. And it is also lead to mortality of the patients. So, and in here, we actually looking into many papers and many research by healthcare professionals to avoid the occurrence of pressure injury. And one of the segments or the areas that we always look out is about the skin of the patient. We all know wound come from skin area. And skin being the largest organ for us, we have to take care of the skin. So efforts to reduce the PI need a prevention. So here we are looking, and today we are introducing HOFA and how HOFA can actually be a part of the treatment of prevention. So like what Kelvin actually emphasized earlier, 80 to 95% of pressure ulcers are avoidable. And this is not just a number, it was proven. However, there must be an intervention from the caregivers and also from the patient. So about the 5%, like what Kelvin earlier mentioned, could be due to patients are heavily sedated, always on bed bound, and on a medication. So that is the reason why the 5% of the patients may not be able to avoid fully the incident of pressure injury. However, what about for us, all of us, 95%, it is avoidable. And how it can be, there is a guideline in which that we can share with you later on as well, that how can we avoid, and as a caregiver, how we can assist the patients to avoid pressure injury. And one of it is about skincare. If you follow Kelvin's presentation earlier, Kelvin actually emphasized a lot on the skin. The soap, I see some questions about the soap. And today I will bring you to the topic of moisturizer. As we know that as we age, we can't avoid the aging. We can't stop the aging, so is our skin. As we age, our skin change. We will get dry skin. We will get skins that sometimes easily tear. So how do we prevent this? So this is an elderly group where they always have a higher risk of a dry skin, skin damage, increase of skin surface pH. That is the reason why we always try to look for a gentler soap. And then, of course, we have a skin integrity, which means the skin might be easily tear, or the skin is a little bit fragile or thinning. Some patients have thinning skin, so it's easily bruised. Of course, here we'll see that also the water holding. All skin hold water. So all this water holding, as we age, our water will be evaporated to the environment even easier. How do we retain the water so that our skin get hydrated? So this is the whole simple routines that everybody can follow. Cleanse the skin always with a pH neutral soap or even a gentle soap. Then moisturize, always moisturize the skin. I think each one of us have moisturizer around. So we know the effect of the moisturizer only. So what or which moisturizer actually makes the difference to us? This is what I am introducing you to today on HOFA. So Linovera is Braun newly launched moisturizer, and it is HOFA based. That's the reason why today our topic is Hello HOFA. So Linovera is actually emollient. So when we into the market or when we walk into the pharmacies, most of the time we are so overwhelmed, We have so many moisturizer, we have emollient, we have lotions, and we keep wondering, which one should I choose? For my patients, for myself, or for someone that I care for at the moment? So these are the different types. You can find this guide in the Google. It's easily available. In other nutshell, we'll say that all these products or moisturizer can be classified into three. One is occlusive. If you look at it, it is the heaviest. Heaviest in the sense is not the grade itself, but it's the texture. So when you apply on your skin, you will feel the layer on your skin. And this is something like cocoa butter, lanolin. Dimeticon is actually the barrier product, is silicone based. And then you have mineral oil, and then you have some wax, Vaseline. So it is occlusive. What does occlusive mean is that it actually traps the moisture in the body than 100% from going out. So that's why you need a very heavy, or rather what we call it, a thick texture moisturizer. Then we go to emollient. Emollient and humectant. Humectants are lotion. We use lotion every day, water-based lotion, any brand lotions. From baby, we use lotion. It is practically just to draw the water to the skin as a hydrator. Then we look into emollient, and this is a very, very unique product, emollient in the market currently. You can see a lot of over-the-counter brand, popular brand. Probably I just, don't quote me, but just some brand like SK2, all those cosmetic, they also look into emollient and they include it in their skincare. Why? It is because emollient are proven that it can actually keep the skin hydrate and also keep the skin moisturized for a longer period. So Usually you will look emollient in a smaller bottle, and most of the product contain plant oil. So it is all about plant. So Lino Vera is indicated for prevention. Yeah? Today, if you happens to have a bottle of Lino Vera on hand, you will see that the indication or on the label, it is specifically indicated for prevention of stage 1 and reversal of stage 1. You can also use it as to prevent even before you have stage 1 pressure injury. You can use Lino Vera for overall skin health, including on the facial. So again, we'll come into this mode of action of emollient. Yeah? So it is usually to improve skin barrier function, because as we improve our skin, moisturize our skin will get stronger. It doesn't tear that easily because of the linking, the strength, tensile strength of the skin will be improved. And why emollient is so popular is because adverse effect. We are talking about adverse effects because we wouldn't want to find a moisturizer, because we're going to use it over the body, that can cause any allergy. Emollient seems to have the rarest or the lowest incidence of adverse effect in the sense of allergy, in layman term allergy. Because sometimes I think most of us also use a lot of moisturizer, different type of moisturizer over our time, you know. So sometimes when we apply certain moisturizer, you will feel that, I have some itchiness, I have redness. So this could be because there's too much of chemical included on it. So for emollient, usually this will be excluded and the adverse effect is rather seldom. So today we are talking about HOFA. What is it, HOFA? Yeah? HOFA is actually an extract from the oil, usually plant oil. And in this case, Lino Vera is containing HOFA from sunflower oil. Sunflower has the highest HOFA, which is in this term is linoleic acid. And why do we actually, what we call that, extract the essential fatty acids such as linoleic acid from the oil? It is because as we extract it out, it making the oil thinner and easier to actually penetrate and absorb into the skin. If today you compare to emollient and the oil, because many people will come over to me and say, come on, since the oil is actually extracted from sunflower oil, why don't I use sunflower cooking oil? It's the same oil, right? Well, technically, yes, it's similar, but it is because when we HOFA, which means we extract the hyperoxygenated fatty acid out from the oil, sunflower oil, we are zooming into linoleic acid itself. So the molecule getting smaller and you will find it less greasier and easier to apply. It absorbs into the skin much faster than normal oil such as cooking sunflower oil. So this is the difference. So if we here, it actually maintain the epidermal integrity, and this is what Calvin earlier mentioned. We have to improve the skin health. The skin must be strong because as the patient have a higher risk of pressure injury, what happened here is that the patient facing forces. The forces can come from the inner part, which is from the bony area. The bone itself already presented a risk. At the same time, you also have an external factor where you have all those, what we call that pressures from equipment, prevention tools that you use, sometimes is from pressing from outside. So as we strengthen up the skin, that is how we prevent the pressure injury. So we have a study by Gomez on HOFA. Out of 524 patients who at high risk group went into proper skincare regime with HOFA, only 1% of the patients is actually develop pressure injury. So if we look at here, from 95% of preventable, now we are moving it into 99%. So this is to say that actually pressure injury, it is avoidable if we actually comply or we actually look into all the aspects around it, like what Calvin shared earlier. Look into the patient as a whole, nutrition, and also a good skin care. And what makes Linovera unique here is that we not only include HOFA itself, HOFA is the main ingredient, however we understand other essence is required. And with this, we actually include this beautiful plant here. Can anyone in the chat actually put up, I put a 5 second. What plant do you think this is? 1, 2, 3, 4, 5. No, nobody actually have any idea what plant is this. All right. If we look into here, we actually include a very special, but a very popular plant extract, Sandella asiatica. Anyone heard before about Sandella asiatica? Pick up the popularity of Sandella asiatica currently is, I would say, top 1, 2, 3 ingredient in the market. What is it actually? Before I reveal the local popular name, I will just let you know what it is about. Okay, in Sandella asiatica extract actually contain a component is known as aceticoside. And what does this aceticoside actually doing is increase our collagen formations. As we age, our collagen production is much lower. So we need to stimulate it. And apparently aceticoside is proven that actually can help in accelerating or increase the collagen body or collagen formation in the body or on our skin. So what is this powerful plant that we have? We also apparently we already know this product from young. Pegaga. A quick one. Has anyone actually eat pegaga before and heard about pegaga before? If yes, you just a quick one. Yes, I can see from the chat is that a lot of people say yes. And what does our audience, mothers, grandmother was telling us about pegaga? Anti-aging. Am I right? So what does it mean by anti-aging in the modern days today in the world of aesthetic? What about collagen? As we have collagen, as we have a good linking, a good skin health, our skin look younger. So it's anti-aging. So pegaga or Sandella asiatica, it is not a new ingredient, but in fact, it is already with us for many generations. A very popular, I wouldn't go too much about this ingredient. I think each and every one of us seen this before. That is aloe vera. So why does we actually include aloe vera? It is to actually to condition the skin, to act as a moisturizer and humectant. If you remember earlier, we have emollient, we have humectant. So in Linovera, one bottle itself, we also include humectant because we understand that the need of the skin to be hydrated. So the skin will be hydrated, add on the emollient to moisturize and block the, what we call that, block the water from evaporations to outside. So it is a need that we include a humectant in the formulation. Then, anyone know this product? This is a little bit Western. So there are many products, especially skin products, that when we choose, we also choose on the base on organoleptic property. And what does this word mean actually? Some of you may have heard of this word before. It is a sensory, it is a smell sensory, which means fragrance. So we include rosemary for this purpose. And the reason being is because nobody wants to walk around smelling like cooking oil, right? So oil itself has a smell. So it has a natural, if you today you walk to your kitchen, you take out olive oil and you smell it, it's the oily smell. So we include rosemary. And why did we not actually include other artificial or perfume? It is to reduce the incidence of allergy, because the more chemicals included in the formulations, each chemical, it is actually carry risk of adverse effect on the user. So today, Linovera, it is solely plant-based. If you have the bottle of Linovera, or you can visit CGM eShop to look into the ingredients, it is only plant oil. No other, no petroleum, no wax, no other chemicals that sometimes you read it, but you do not know what is it because the name is so long. Butandiol, tetradiol, all those ingredients, it does not contain any of such ingredient. So for rosemary, it is to increase the compliance. When the product smells good, you tend to use it. Because if the product is smelling not so pleasant, you will try to say, okay, let me use once a day because I really don't like the smell. So rosemary is actually for the organolactic property of the product itself. So in a nutshell, we have 4 powerful plants here in one bottle of Linovera. And all it presents to you is to protect your skin from external agent, improve the skin resistance in the sense that you are actually, we actually change our epidermis frequently. It is to renew it faster, restore the capillary circulation, stimulate the synthesis of collagen, and it has a hydrating effect thanks to the aloe vera and the healing effects from Centella asiatica. So all you have to do is apply it twice. So what's the difference here between humectant, emollients, and all those occlusive moisturizer? For occlusive moisturizer, because of the texture very greasy, likelihood you only apply once a day. But for emollient, you can apply every 8 hours or 12 hours. And this is suitable for you as you change the patient. Sometimes if the patient is on the positioning where it limits their mobility. So patient is lying down. And in the morning, you are changing the patients or you're changing the care. So you actually position them and then you apply once. And then after 8 hours, probably in the evening, after their evening bath or cleaning, you reapply again. So you do not need to apply as frequent as lotion because the lotion is actually just a hydrator. Apply the water and then it's evaporated. So that is the difference between lotion, emollient, which is the oil base, and the occlusive, which is the barrier product. So before I end my presentations today, just a quick sharing. You can go to Google, you can go to the web and you just write HOFA, Linovera. You will come across with many scientific papers proven the efficacy of Linovera in preventing pressure injury. So this is one of very impressive paper. It's conducted in Italy. So all the patients and the healthcare workers that actually use the product give a very good feedback, good, and very good. And this is the reason why is because the patients that they are treating with this HOFA are elderly. So we have one patient 77 years old, 2 patients in their 90s, yeah, and 1 patient even 100 years old. Usually when you have a patient at the age of such age, 99, 90 over and 100, usually their skin are very sensitive and very frail. So after they use the Linovera, all these patients actually can reverse the stage 1 redness. This is how it looks like after they apply for a week. So with that, I will say thank you very much everyone for the time. Thank you CGM team members for allowing us to share with you this fantastic HOFA. And the name of the product is Linovera. For more information, you can just ring us up. So thank you very much.
All right, thank you, Carmen. Wow, we not just learned about pressure injury today, but we also learned about plants, yeah? It sounds like a very, very hopeful product, and it can help the patients with pressure injury. So thank you again, Carmen, for sharing today. It's really wonderful. So now we will go to a Q&A sessions. I saw some of you ask, let me scroll back to one of the questions from Sri Devi Arunasalam. Can we get a sample of it, of the Linovera, right? So luckily today, Braun, they have sponsored us with the lucky draw. So at the end of the session, lucky draw, we will have 20 bottles Linovera to give out. So you want to wait until the end. All right. So okay, for those who have questions, you may unmute yourself and come in to talk about it. If not, I will read out from the chat. You can post in the chat as well. All right, for this session, we also want to welcome one of our organizers, Sister Lim. Sister is not the nun sister, yeah, not the church sister, yeah. She is our nurse sister. Okay. Okay, so Sister also have a very great background. She has nursing for more than 20 nursing experience for more than 20 years already. So she had a Bachelor of Health Science from Victoria University of Technology, Melbourne, Certificate of Attachment from PPUM in Stomach Care and Diabetic Foot Ulcer, which is close to our topic today. Certificate of Hyperbaric Attendant and Panel Operator from Hyperbaric Health Australia. And she's also a certified HRDF trainer. So welcome, Sister. All right, let's get to the questions. I missed the Ripple mattress can prevent pressure sore if no positioning due.
Of course. Takkan itu pun tak tahu.
So Kelvin, would you like to answer that? I think pressure sore, the mattress, it was from your slides, right? Kelvin, you can unmute yourself. Kelvin?
Sorry, my mic.
Here you go.
Okay, so Ripple mattress can help slow down the progression of pressure sore. It does not prevent it. Okay, I know some Ripple mattress sellers, they will tell you that if you put the Ripple mattress, you will not get a pressure sore. Actually, it's not true. From our experience, I'm sure Sister Lim can agree with me. Even with a Ripple mattress, you still need to position the patient. Instead of 2 hours, you can probably drag it a little bit longer to, I'd say, a maximum of 3 hours. However, you still need to reposition the patient. So it is not 100% prevention for pressure ulcer if you use a Ripple mattress. Hope that answers the question.
Yeah, just to add on to Kelvin, reply, even the Ripple mattress also have a different level or different category. So, if it's like, a certain way, you can use the low grade Ripple mattress. But if, let's say, the patient is more heavier and also, very, very dependent on, a carer, then you may need to use those high-end Ripple mattress. Yeah, Ripple mattress is not solution. You still need to do turning, definitely.
All right, thank you. Okay, next question. Can HOFA be applied on face? Will it cause acne? This will be common. Cameron, you want to answer that?
Well, I think acne is generally, we have to look into the root of the acne. So I can't say yes or no. Here's to you is because acne caused by many factors, but it is, if used to an extreme dryness, yes, it can be used. But if it's caused by any other factors, I think the best persons to advise is actually the dermatologist or your doctor.
Okay, we have another question from Man Eng. is this only suitable for elderly? What about patients with eczema? Oh, great question.
Okay, sister, would like to take over this question?
Yeah. Okay. Now, when it comes to eczema, again, when we say eczema, we have the the acute phase, when the patient is having an acute flare up. Of course, during that point of time, you need patient will need steroid or other kind of medicated cream for treating the acute phase. But if the patient's skin is on the so-called the normal time and there is no acute inflammation, you want to keep the area, the eczema area moist and nice. Yes, you can use Lino Vera. Yeah, because like I said again, when this is you use it on the normal time as a maintenance, that is okay, but not when it is acute, because that you need a medical treatment.
Okay, question from Esther Low. Regarding collagen intake for our skin, what are the products that you recommend?
Who is this question directed at?
No, I think it's more towards to Lino Vera. So whoever for three experts here, maybe you guys can help out on this.
Well, I think we can open for a discussion. This is a very interesting because what we eat is who we are. So if you are taking collagens, you should see some improvement on your skin as well. But however, moisturizer, which is to apply directly to the skin, is very important. So this is because the skin itself has its own structure. So by applying moisturizer such as emollient, Lino Vera, you are actually acting on from the top of the skin down. But when you eat or you take nutritional product, it is actually from inside out. So I guess that if you taking it and you would like to boost it two-way, fantastic.
Right. Okay, we go to the next question from Yang Siu Kim. Do we need to rub in or apply lightly when we use this Lino Vera?
Sister, would you like to teach how to use Lino Vera?
Okay, like Kevin mentioned just now, whatever that we apply on a patient, fragile skin, on the patient's skin, we should not rub, all those massage. We should not, because the moment when you massage, you are actually causing a lot of friction under the skin, the skin structure. So you actually cause more harm than helping the skin. So when you're using Lino Vera, it's just gently apply or rub on the skin, on the affected area, but not massage. Okay, not like you are doing some all this like when you're doing it on your own skin, you should not So because we always have to bear in mind that this patient, their skin are already fragile, so therefore we have to handle it with care. Just gently rub onto the affected area.
Okay, from very early, we have a question of why we need to avoid soap-based agents. I think this question was during Kelvin's presentation.
All right, so one thing you need to understand about commercial soaps, commercial soaps, once the process is done, what happens is that they remove the glycerine component from the soap. Okay? The glycerine component is sold to more high-end from cosmetic companies for them to make moisturizers and so on. So unless you can get handmade soaps or non-soap-based cleansers, what happens is that if you use the commercial soaps, it will definitely dry your skin out very fast. And especially for people who have very sensitive skin, you find that if you use those commercial soaps, your skin can dry out in a matter of, I say 1 or 2 times after you use it. Right? So it is important that if you have dry skin, use a non-soap-based cleanser, or if you insist on using soap, if you're that traditional, you should get those handmade soaps, those that people make in small batches.
Okay, thanks, Kevin. So we have a question from Pasumawati. Pasumawati asks if can HOFA apply to psoriasis. I hope I pronounced that right.
Psoriasis and eczema, this is a skin condition. So, so again, it's the same thing. If it's not on the acute, if you want to keep it, keep the affected area moist and well moisturized, yes, you can use Leno Vera, but not when it is acute. I just want to add on to what Kelvin explained just now on the soap. Yes, because when you're using normal soap, what it happens, it actually wash off because our skin do have oil gland. Yeah, so this will keep our skin moist, and that's why we see, younger people, their skin are so nice, so smooth, because of this oil production from our body. So if you use this so-called chemically, this kind of soap, that it will wash off this so-called this protection layer. So it will cause your skin become very dry. Yeah.
Okay, from Siti Farah, which ointment is best for wound healing? Do scabs heal faster dry or moist?
Okay, I'll take this one.
Sure.
Okay, Siti, first and foremost, we need to see what kind of wound it is. Right? Not all wounds are treated the same. And even if there is a wound, at different stages of healing, different things are required. So if you talk about, I can see your second question there, do scabs heal faster, dry or moist? When you get a scab, right, a scab is already a very natural healing that the body is doing. So if you already have a scab, you should just leave the scab alone. The body will heal and the scab will fall off. Don't peel the scab and then bleeding will start all over again. So I'm not too sure whether you're asking about whether it's better to let the wound dry or heal in a moist condition. Because if that's the question, then wound healing happens much better in moist conditions, right? Gone are the days whereby we just put a dry gauze on the wound and hope it heals fast. Nowadays, a lot of research has been done to show that wound healing happens best when the wound is moist, not wet, yeah? Because a wet wound is very dangerous for the surrounding skin. So a moist wound is what we try to maintain all the time.
She also asked that shall I put Vaseline on a scab?
Answer to that is no, because scab is already a very natural way the body is healing the wound, and it's already towards the end of the wound healing. So there is no need to put any Vaseline on the scab, right?
Okay, we will take one last question now because we are not just running out of time, but over the time already. I believe everyone wants to go to the lucky draw sessions. Yeah. All right. So is HOFA only suitable for certain age group of patients?
No. HOFA is actually, or Leno Vera in this sense, is actually can be used in throughout any age. But for those children below 1 year old, you just use a small amount to do a test patch. If the skin can actually accept the product, just like any product we use on the kids. If there is no inflammations or no allergy sign, you can continue to use that product with the child. So actually, Leno Vera, because it does not contain any chemical at all, mainly the plant extract, so it is safe for any age.
Okay, thank you. So for those who we didn't get to your questions, don't worry. We will later on from the e-certifications, we will send that with the answer together. All right. Okay. Finally, we come to not lucky draw yet, but group photo taking session. Okay, let's turn on your camera. Have you put on your makeup? Or maybe dress up a little bit, at least half, upper half of your body. And let's turn on your camera, everyone. please stay your charming smile. Yeah, of course. For those who don't, you're wearing mask also. When you smile, we can see your eyes are smiling as well. So please keep your smile, and it will take a little bit of time because we have 150 over participants here, right? All right, smile. Put a good sign. Yes. Okay. Hang in there, yeah. You want smile different pattern also can. Are we good? Smile, yeah, smile. No need to turn on your phone, your speaker. Okay, I think we are good. Awesome. Let's come. Okay. Our next session, the last session everybody is waiting for, is our lucky draw session. Yeah, no more Q&A. We go to lucky draw, right? Okay, thank you so much, and congratulations for all our winners today. So again, let me share with everyone that the prizes and also the sign up frisbees for those who did not get the lucky draw, don't get disappointed because we have the sign up frisbees. We will deliver that. We will send that to your registered email. Registered address. And also, if everyone here today you like today's session, or even if you don't like it, please fill out the feedback form for us. All right. The feedback form we have sent to your email. Please give us some feedback so we can improve from that. We will also email you an e-certificate for participation by this week. So, all right. Maybe we can turn the music now. Or if everyone can hear me, doesn't matter, right? Okay, since we have come to the end of the sessions, I want to thank you everyone today. Thank you for joining us today, and also thank you for all the organizers. Thank you Caregiver Malaysia. Thank you Braun, JaGa, Sunway TCM, Education Network Consultants, speakers Calvin and Carmen. Thank you, and thank you everyone here today for making these successful events.